I've been for help, communications to our members, and also to get our local businesses back to normal. We have initiated what we are calling our Live Local campaign, whose goal is to encourage our members to shop and consume locally. Signs are being placed in yards, social media efforts are in place, and I believe, our mayor, a resident of Little Forest Hills, also has a sign in his yard. But yeah, so thank you for your support, Mayor Johnson, and all for East Dallas, and really for all of Dallas. We don't want you to play favorites for East Dallas, even though we are the best, but I know you support all of Dallas and are great on that. So, but thank you very much for your support of that. While this is top of mind for many organizations with the current issues that we have continued to provide services and support as we are now celebrating our 75th year as a Chamber of Commerce. So I'm very excited about that. Moving on to the main event, my message was going to be short because we want to get right to it. So moving on to the main event, I'd like to introduce Renee Barrera from our Legislative and Economic Growth Committee to lead us in the conversation with Mayor Johnson. And again, welcome to everyone on the call. Renee.
Thank you, Steve, so much. Just want to make sure that everybody is aware that we are recording this event. So just be aware that I did hit record right as Steve started talking, just making sure everybody's in the know on that. Mayor Johnson, thank you so much for being with us this afternoon, taking time out of your busy schedule. Sorry that we weren't able to meet at our esteemed Lakewood Country Club as we normally are. Been looking forward to this event for quite some time, and we're just very grateful that you're able to do it, even by the means of Zoom. It'll work for us, and it'll work for everybody else. Thanks everybody for being here. I wanted to do a little introduction of Mr. Eric Johnson, who is our 60th mayor of Dallas, who was elected in 2019. Mayor Johnson did attend DISD schools. Yay, I've got both of my kids at DISD, and we're working hard for that. Thank you very much. Through the first grade, before he earned a scholarship to Green Hill School through the Boys and Girls Clubs of Greater Dallas. After graduated high school, Mayor Johnson earned his undergraduate degree with honors from Harvard before earning a graduate degree from Princeton and then his law degree from the University of Pennsylvania Law. Mayor Johnson has been a practicing lawyer in Dallas for over 15 years. He's a former member of the Texas House of Representatives. Thank you for your many years there. He represented Dallas from 2010 to 2019 and served on 20 prominent legislative committees, as well as the chairman of the Dallas Area Legislative Delegation. He and his wife, as was mentioned earlier, live in Forest Hills, and they have 2 sons, and they love East Dallas just like we do. So after that awesome introduction there, you've got a lot of, there was a lot more to it. I had to condense it quite a bit there. So thanks for all you do again. Mayor Johnson, why don't you go ahead and start, let's begin by addressing how COVID-19 has impacted our city, especially small businesses like those that our chamber membership is mainly comprised of, and those that have been greatly impacted. Let's see if we can address a little bit the state of the city with a bit of emphasis on East Dallas, of course, because this is the East Dallas Chamber of Commerce, and maybe just give us a quick update as well on the 2 projects of interest in our area, which is Garland Gaston Grand and LBJ East. Take over, my friend.
All right. Well, first of all, I want to say thank you, Steve, and thank you, Renee, for that very kind introduction. I really do appreciate the opportunity to be here with you today virtually. I wish we could all be together physically today, but I'm glad we can still have this meeting today in some form. So thank you for having me. I do make my home here in part of Greater East Dallas, and I do proudly display one of the Live Local East Dallas signs that you've been seeing around our community on my yard. So I have one of those signs up, and I am the mayor for all of Dallas, but I have to say I am partial to home here in East Dallas, so I'm proud to support that effort. I know that these last few months have been rough for our business community. The emergency restrictions that I issued in the early days of this crisis have weighed very heavily on me. And while we rely on the county, which is our publicly contracted health authority, for much of our health response in the city, I've thought a great deal about our economic recovery. Dallas is a city of dreamers and doers. And East Dallas, in my humble opinion, is our city's soul. It gives the city personality, it gives it character. It's a haven for small businesses and entrepreneurs that are going to be critical to our city's economic recovery. So, with that in mind, I want to talk to you about three things: what we're doing to recover economically, our city budget, and the importance of testing and contact tracing as we try to move forward dealing with this pandemic. So first, let's take up economic recovery. Back in the early days of our stay-at-home order, I asked Richard Fisher, which I'm sure some of you know or have at least heard of, who's the former president and CEO of the Federal Reserve Bank of Dallas, to lead a task force on economic recovery. He agreed to do that, which I was very happy about. And since then, he's enlisted the help of a gentleman named Fred Perpall, who's the CEO of the Beck Group, to serve as his co-chairman. Now, while I was initially planning to serve on that task force, I decided that it would be best if it were a purely private sector effort. And so I decided to make sure that the committee, the task force, did not include any elected officials or any political types. I didn't want to see it become a political deal. I wanted it to be a purely private sector led effort. I expect this task force to make recommendations, however, to city leaders like myself about how we can help our businesses, especially our small businesses, bounce back from this pandemic. At the city level, we took action to help those in need through a committee that I created to address COVID-19 economic recovery and assistance. We've created a small business continuity fund using money that we received at the city through the CARES Act from the federal government. That program is offering $5 million in grants and loans for small businesses in Dallas that have been affected by coronavirus. That money is meant to help some of the smallest businesses that we have, or businesses that employ a high percentage of low-income workers. And that program is tied specifically to job retention. And what we're working on next, and I've been pushing very hard for this, and this is critically important to our recovery, and I can't emphasize enough how important it is that this group be aware of this program and hold our city leaders accountable for making sure that we get this done, because this is critically important. And that is an effort to push more of our city's contracts. And we do millions of dollars worth of business at the city, but we need to push more of those contracts to local workers and local firms. So if any of you watched the city council meeting last week, I made a rare move. I mean, I can't remember the last time I saw a mayor pull any items off of the consent agenda, which are the things that are supposed to just, kind of move through the process without any debate. I pulled every contract off of the consent agenda that was awarding a contract to any firm to have a discussion about what the process was that settled upon that firm and whether or not that firm was local and whether or not it hired any Dallas residents. We have an existing law on the books that allows us to award contracts to Dallas-based companies as long as they come within a certain percentage range of the low bid for that contract. But I want to make sure we're doing a better job of outreach to Dallas businesses and encouraging businesses to be located in Dallas. And I think that's super important, because it's one thing to have a policy that's buried somewhere in a city ordinance or in some city policy manual in the city manager's office that's based on a state law. But it's another thing for the public and for small business owners to actually know it exists and to hold the city accountable for using it. And my fear and my concern is that we have this policy, but nobody knows about it, and we're not pushing it, and we're continuing to send City of Dallas tax dollars outside of the City of Dallas. And so I'm very serious about this. We need to move on this policy, and I'm frankly not going to be happy if there's any undue delay or any foot dragging on the city council with moving this policy forward. We also have a process where sometimes we score bids, and a big change, I hope, will be coming to how we handle those. And one of those changes that I'm pushing for would be to award additional points to any company that's located in Dallas or that plans to or does currently hire locally. And I'm hoping that we get that passed later this month as well. So stay tuned and pay attention to what the council does and what we all get done on this front, but I think this is critically important. We should have all along been doing a better job of keeping Dallas tax dollars in the city of Dallas. It's actually unfortunate that it's come to this, but it's now critical that we get this right, because it's critical to our city bouncing back as quickly as possible, that we spend our money. And by the way, it's your money, just so you know, in case you were wondering where Dallas tax revenue comes from, it comes from you. It's critically important that we take that money and we spend it on you. And we have contracts at the city, and we spend money at the city on everything from catering lunch to our meetings to massive construction projects and everything in between. So there's no size business that should not be excited about this new focus. So again, hold the council accountable for getting this policy passed. We're going to get through this. We have a diverse economy with some very important assets, and we have a very active and collaborative business community that you guys are a part of that's really stepped up and helped during our time of need. And I truly believe because of that, that we're uniquely positioned to recover perhaps better than any city in the United States of America. Next, I want to talk about one of the reasons why it's important to me as mayor that we recover economically and that we recover as quickly as possible. And that's our city budget. We are staring down a budget shortfall right now of $25 million for this current fiscal year, which ends on September 30th. Now, that may not sound like a ton of money to some of you, but with a $1.3 billion general fund budget, that may not sound like a huge amount. But you got to remember that half of the fiscal year is already over, but was already over by the time that COVID-19 started, and by the time it began to spread in our city, we already were more than halfway through the year. So, as you've likely heard, our city managers decided as one of the ways to approach this pending budgetary shortfall is to furlough nearly 500 employees through July to help us save money. For the next fiscal year, which begins on October 1st, we're projecting that we could see somewhere between $70 million and $134 million in terms of a shortfall. And this is also after we've sustained tens of millions of dollars in tornado damage that was uninsured. This is what our insurance company did not cover. We're hoping that the federal government will pay for some of that, but at this point, we're actually still awaiting a response from FEMA on that, and the president will have to ultimately make that decision. So we're still looking likely at very significant cuts to our budget. We have a budget of about $30 million for our entire code compliance department. I mean, I'm talking about the whole code compliance department costs us about $30 million. So we could cut completely code and animal services, which costs us about $16 million, and our library system, which costs us about $32 million. And we basically just cover the low end of that projection I just told you that goes up to $134 million potentially. I mean, so to put that in perspective again, we're talking about if we were to eliminate those entire departments, not do any code enforcement at all in Dallas, not do any animal services at all, not do any libraries at all next fiscal year, we would just make up the difference in the low end of the economic shortfall projection. So we're obviously not going to do that. We're not going to cut those departments in their entirety, but we're going to protect the core services that our city offers as much as possible. And I'm going to do everything I can to make sure that those cuts that we do have to make are made in an equitable way. But make no mistake about it, we're going to have to make difficult choices to balance our budget. And for those of you who don't know, and I assume everyone on this call does, we do have to have a balanced budget at the city. We're not like the federal government. We can't run a deficit. We have to have a balanced budget every year. So we're hoping to get some additional assistance from the federal government, either in terms of a greater flexibility in the money they've already allocated to us, or in additional funding. And this aid is going to be critical to ensuring that we don't have an even deeper recession here in Dallas. But even if we get that additional funding, it may not cover everything. We're going to have to be innovative, and we're going to need your input to help us through this. And so finally, I want to talk to you about what I believe is the key to us moving forward. and that's testing and contact tracing. In the last 2 months, with a collective effort of the city of Dallas, Dallas County, the federal government, state government, the private sector, we've seen significant increases in COVID-19 testing in Dallas. We know this because in large part, we've been tracking this throughout the entire pandemic, essentially. At the beginning of our city's response, I issued emergency orders that required the reporting of testing that was being conducted in the city of Dallas. And we knew then that testing and data collection generally would be very important, would be critical, in fact, to our public health response and to our recovery efforts. But like everywhere else in the United States, those of you who watch the news or pay close attention to this, and I'm sure it's most of us on this call who do that, like everywhere else, we need a lot more testing here in Dallas. And with businesses gradually reopening in Texas, the need for more robust testing and a more robust testing regime and focus on healthcare access is even more vital to ensure public health and to restore our vibrant economy. The governor has moved into phase 2 of his reopening plan as of yesterday, but he can't open the economy by order or by fiat. Nobody can. We have to do our best to make people feel safe going back out into the economy. So until people feel that they are safe, we just can't expect a big uptick in our local commerce. And that's where the testing and tracing comes in. This is not a political thing. This is not about trying to score a political point or pick a side. It's just the reality is, and you folks who are on the ground operating businesses know this, consumers drive the economy. Consumers dictate how successful you're going to be. Not the governor of Texas, not the president of the United States, not the county judge, not the mayor of Dallas. We can declare everything open today, but that doesn't bring customers or clients back to your businesses. What's going to bring them back into your businesses is feeling like it's safe to do that. And that's what we have to do. We can't just issue a bunch of orders and think that's going to bring the economy back. We have to help you by providing that safety, that security that consumers need to start going back into your businesses. So I want to say that I've been very grateful for the help that we've gotten from the federal government and from the state. And I appreciate the work that the county's done. And in fact, even our private sector partners have stepped up to help us bring more testing and improve healthcare access in our city. I'm grateful for all of it. But COVID-19 has required a multifaceted response, and testing and access are just a piece of a much larger effort. And as much as we rely on Dallas County as our public health authority, about 44% of the county's cases of COVID-19 are actually not even in the city of Dallas. So almost half of their work is outside of the city. Half of what they have their hands full working on and trying to deal with is non-Dallas stuff. So we can't just rely on them because they actually have a responsibility to a large number of people who are not Dallas residents. So it's our job as city leaders, it's my job as your mayor to look out for your interests as a Dallas resident. And that's exactly what I'm doing. And I have no qualms about it. And I'm unabashedly pro you. I'm 100% yours, in your corner. I'm not fighting for Irving right now and Garland or anybody else. I'm fighting for Dallas. And while we haven't yet seen any disproportionate health outcomes by race or anything like that in Dallas County, we do see national data, and we know that national data has shown some broad disparities by race, by ethnicity, by income, by some other factors as it relates to COVID-19 hospitalizations and deaths. So I'm also committed that in our city, we're concerned about, and we're going to make sure that we address and make sure that we are out in front of the many families that just don't have the same access to healthcare and testing as other folks. So in other words, we're not going to let the least of these fall behind, not here in Dallas. So it's become clear to me that at the city, we need someone who can work with all of our partners and someone who's going to be singularly focused on these issues I just outlined for you. And that's why last week I announced a gentleman named Dr. Kelvin Baggett, who's going to serve as our city's COVID-19 health and healthcare access czar. Kelvin has a very impressive background as a healthcare executive, as a licensed physician, and he understands and embraces the challenges that I've asked him to take on behalf of all of us here in the city of Dallas. We have to make sure that all of our communities have access to testing and that we are effectively conducting contact tracing and that our residents have access to healthcare. And Dr. Baggett is going to be working with the city of Dallas. He's going to be working with Dallas County Health and Human Services, all of our hospitals and our very impressive hospital system that we have here in Dallas, our private sector partners, our faith leaders, our academic institutions, and of course, the task force on economic COVID-19 economic recovery that I mentioned before that's being chaired by Ambassador Fisher and Fred Perpall. This is truly the proverbial all hands on deck situation, and it has been from the very start. This pandemic affects everyone. It doesn't affect everyone equally, of course, but no one, I mean, no one is going to be immune or is immune to the effects of this insidious virus on public health and our society, broadly speaking. So I'm looking forward to working with the business community on all of these initiatives moving forward. And I just want to wrap up by saying that I'm really, really proud of how this city has responded to coronavirus. This came out of nowhere, it seems, and it shook the very foundations of our city, but it didn't and it won't break us. We're too strong and we're too resilient of a city for that. And this isn't where any of us thought we'd be just 3 months ago. I would have guessed I'd be talking to you guys today, first of all, in person, but second of all, I thought we'd be talking about Dallas Works, my summer jobs program for youth, or about the city's latest economic expansion plans, corporate relocations that we're chasing, about my plans to increase the city's presence on the international stage and attract more embassies and consulates to Dallas so we can grow our international stature. But we had to change some of those plans because of this virus, and we had to put some of them on the back burner. Like all of you, we've been rolling with the punches, and now my focus is entirely 100% on making sure that this city bounces back stronger than ever and faster than anyone else in the country. I've accepted that I'll forever be the COVID-19 mayor of the city, and I embrace that challenge. I hope all of you will embrace the challenge that faces all of us too. We'll be remembered and measured by how we respond right now during these times. I know and I trust you will all step up and do what you can to help your city. And I vow to you that I'm going to do the same thing, and I'm going to continue to pour my heart and soul into this city's recovery the way I have been since late February when I first heard that we were going to be facing something that we hadn't really anticipated. So with that, I'll just say thank you, and I'll turn it over to whomever is going to be moderating the questions, because I'm sure there are some.
Thank you very much for that, Mayor Johnson. That was awesome. You really focused in on a lot of things that were part of the questions that I had coming to you. So thank you for jumping out and giving us that great overall view of what's going on. Thank you for focusing mainly on those support local, hire local, live local, be local. We, as a Chamber of Commerce for the East Dallas area, that is what we're really in tune with. One question that I thought of the many that I had that really came out of what you've been addressing is, that potential second wave of this COVID-19. And if we were to experience that, what can be done on the city's standpoint in order to prepare for that? And if and when we should encounter that, do you anticipate the potential for another shelter in place?
I hope there isn't a second wave. Let me say that first. I hope there isn't. Models predict different things. There's as many models as there are epidemiologists out there that predict different things. So I won't shock any of you by telling you I'm not a public health expert. I'm not an epidemiologist, so I have no way of telling you which one of those models you should believe. I can't tell you which study is correct. And I also, of course, don't have a crystal ball to tell you what the future holds. Here's what I can tell you about what I think is important that we do to be prepared. First of all, I think the best thing we can do to try to avert a second wave here is in light of all the reopenings that are occurring, we have to do what we can, what's within our individual power, to keep our number of infections at a growth rate where our hospital capacity can absorb it and we can deal with the cases. We can't afford to get lax at all on I'll give you a list of things that we just cannot let up on. We can't let up on mask wearing. That has to become the new normal for the foreseeable future. We've just got to continue to wear masks when we're out in public. We're going to have to start getting more masks for just everyday folks. For a long time, the effort was really around making sure first responders had them and make sure doctors and nurses had them. Well, everybody's going to need them, and we're going to have to start getting those donated and distributed to folks who can't afford them, and just because it's for all of our benefit. It really is. So the mask wearing is just very important. Maintaining social distancing, I don't have to go into what that looks like. We've been doing that for several weeks now. We have to continue to do that for a while. Now, the trickiest one of those steps that we have to take to kind of keep this from spiking again is, now that the economy has been declared open by the one person in the state of Texas under state law who has the authority to do that, which is Governor Abbott, and he's done it. He has said it's opening at this rate. It's opening in this way. This is the schedule. I have refused, and I continue to refuse, to criticize or Monday morning quarterback decisions that have already been made. He's the governor of Texas. He's decided it. It's our responsibility now here locally to make sure that it works for us, for our own well-being. So the trickiest part now is how do you re-engage the economy, and how do you decide to go back, and when and where? I would tell you this, in the short to medium term, for sure, if you are showing symptoms, and if you want to list what the symptoms are, the latest list, we can direct you to the cdc.gov website and you can look at them. If you are symptomatic, don't leave your house. Stay home. Stay home and see if the symptoms go away or if they get worse. If they get worse, you need to get medical attention. But symptomatic people need to stay home. Even if the law says you can go to a bar now because bars are open, I'm asking you, if you're symptomatic and you live in Dallas, don't do that. Please stay home. If you are a member of a vulnerable population, I've heard someone describe it this way as a rule of thumb. If there's a pill you take every single day that keeps you alive, you're in a vulnerable population. You need to think twice during this period about whether or not you want to be out at bars and restaurants and other things. So we want people to be careful. And if we do those things and we're really dedicated to that, we can help as much as we can to keep that curve as flat as possible for as long as possible, and not to have it spike in a way that actually strains our healthcare system and where people get sick and potentially die because they don't have access to a ventilator or an ICU bed. Now, if somehow this fails, and I don't like to think about, failure situations, but if it fails and we do have that spike because we're not doing what we're supposed to be doing, we take our foot off the gas and we think we're home free, we think we're out of the woods, so we start having pool parties again, and we start doing all the things that we were doing before this happened, and we see the cases spike, then that's when it shifts back to the folks in the public sector to make some tough decisions. The governor's going to have to make some tough decisions about whether or not he wants to reverse his executive orders and start ordering things closed again. And we're going to have to make some decisions, and I can already tell you where I am on this in terms of helping with hospital capacity. If our hospitals get strained, I'm prepared to reach out to our federal partners again and tell them we need the United States Navy and the National Guard and everyone else to come and flip the switch on the K. Bailey Hutchinson Convention Center overflow hospital and get that thing cranked up as high as a couple thousand beds or whatever it is they can accommodate if we need to, 1,000 or so, 1,500 beds or whatever it can do, to make sure that people don't die for lack of access to a hospital bed and a ventilator. So that's what I'm prepared to do if it spikes, but our goal is to make sure that doesn't happen.
Wonderful. As far as East Dallas is concerned, is there anything specific that we as a community here can do to help in this cause? Is there anything that you can reach out to us as members of these small businesses and or the Greater East Dallas Chamber of Commerce that would aid you in moving forward with this progress that we've already made, so that we can continue to see the same type of progress with the best possible results? We can end on that.
Okay. Well, I think we will need your help, and I want to connect all of these businesses in East Dallas who have feedback to share, who have thoughts they want to share with Dr. Baggett, because one of the things he's going to be working on is trying to figure out not, what I think or what, folks who don't have the training in epidemiology and public health and medicine think about what you need to be doing to, in fact, make sure you're operating safely. We want to find out what the experts say you actually need to be doing to make your business safe for people to use it. So then we can tell people that you're doing it, so they will have the confidence to come back to your business. So let's pretend like you're a restaurant owner, and for all you restaurant owners who may be on the call, it's not about my opinion about what you need to be doing. It's not about what some elected officials think. Let's get you the information you need to know what the experts in health say your business needs to be able to tell the world we're safe to open, we're safe to operate. And if that's temperature checks at the door and this particular technology that maybe it's a handheld, an app for your phone that asks you a series of questions, and if you can answer in the affirmative in an anonymous way, we know that you're good to go. Whatever, these things are all out there. If that's what the experts say we need to convey to the public that your business is safe, then let's get those tools into your hands so you can open up again safely. And so I will connect anyone who wants to Dr. Baggett. He's working on coming up with what those recommendations are, so you guys can implement them and we can get people back to your businesses as soon as possible.
I think that would be great if we can somehow help the businesses install effective COVID protection for customers and employees that are going to be put in place, that hopefully, the czar will help us determine. That sounds like something that would genuinely benefit us as small businesses and the revamping of getting businesses running again. So I'm sure that's probably something that he's taken into consideration. As part of the Greater East Dallas Chamber, we are here to help with that initiative however possible. Please reach out to us directly and let us know, as the business leaders that we are, where we stand in that fight against this pandemic, so that we can do our part. If you got any closing remarks, feel free to throw them out at us. Taking a couple of minutes extra.
I'll close with this by just saying, anyone who wants to reach out to me for that purpose or for any other purpose related to COVID-19, I want to give you my phone numbers and my email. Okay, so I'm going to start with my office phone number. That's 214-670-3301. Again, that's 214-670-3301. My email is Eric with a C, ERIC.Johnson@DallasCityHall.com. So please reach out to me if you'd like to be connected with Dr. Baggett, because you have feedback or questions about how to open up in a way that will encourage folks to actually utilize your business because they feel safe, or if you have any other comments or questions about our COVID-19 response. I'm happy to talk to you. I thank you so much for having me here today. This is great. I love you guys so much. Thanks for all your support.
Thank you, man. Thanks for being one of our best mayors and local to us. And we know you're right around the corner from us, and we all love to live local and know that you've got our back. We look forward to some sort of a publishing that the czar will put out to practices and businesses. I think that would be exceptionally helpful to everyone. And certainly, thank you for giving us all your contact information and for taking your time this lovely afternoon and being with us. We'll let you off without the Garland, Grand Gaston, and 635 deal. We know there's a lot going on there that genuinely impacts those same businesses that we're focusing on. So we'll keep our fingers crossed on that. And if we can help in those aspects and realms as well, let us know. We know we have a two-way street here, and we're here to help each other. Thank you, everybody who took their time out of their day to join our meeting today. Again, our apologies for not having that beautiful and delicious country club lunch. I hope everybody enjoys their own meals together, and maybe someday soon I'll see you out at one of our local eateries and or with a cocktail. Thank you very much, everyone. We will go ahead and conclude the meeting. I'm going to look here through some of the chat. If you'd like to stick around a little bit and chat some through the chat box, feel free to do so. Mayor Johnson, we appreciate you so much, my friend. Take care, and we'll see you soon.
Thank you for having me, guys. I'll see you around.
See you soon.
Great.
Mr. Moore, you're on.
Okay, thank you, everybody. In conclusion, again, thank you to Mayor Johnson and Mr. Barrera for conducting this and getting this going. Nice job. Everything, I think, worked well. And our 35, actually, we were like 45 participants. People are getting off right now. But to conclude, and kind of what Renee said, please let us know how the Greater East Dallas Chamber can help you. You know, that's what our role is. Our role is we are 300 members strong. We are here to help you in East Dallas. So please contact us, connect us, do whatever we can to help you be successful. We'll always be here. That's it. Thanks, Renee.
Again, thanks to everybody, especially for the recommendations on the wax for the mustache. It's coming here soon.
That's impressive.
Have a wonderful day, and we look forward to all your participation in all of our events. We will have more of these types of meetings if needed. Certainly, we're all hoping that we can get back together in person soon. I know we all need a hug.
Awesome. Okay. See you guys.